Hi, I'm Dr. Pete Nightingale. I'm a GP in Lancaster, but I'm also the National Clinical Lead for End-of-Life Care, which is a joint post between the Royal College of GPs and Marie Curie. The really good news about pain management towards the end of life is that we have drugs that work. And the main drugs are often morphine related. And we're fortunate that for the vast majority of people, morphine or drugs related to morphine will work very effectively. We tend to start off with simple painkillers such as paracetamol, which is effective, and then we'd move on to medium strength painkillers such as codeine type drugs, and then step 3 are the morphine type drugs. All medications can cause side effects, but with the vast majority of drugs that we use to control pain and other symptoms at the end of life, the side effects can be managed. We quite predictably know that morphine will cause problems with constipation, occasionally with nausea, but we have drugs that we can use to deal with this. There may be other side effects with other drugs. Almost always, if the communication's good and clinicians know about it, we'll find an alternative drug and we can get symptom control to be excellent. Patients are given a prescription and they would often take it to a chemist and they're given instructions as to how to take the drugs. What we do know is if patients work with their pharmacists to ensure that they have a clear understanding of how and when to take the medication, the pain control's better because the drugs get taken in a more effective way. Pharmacists will often deliver drugs to somebody's house to help the carers. Increasingly nowadays, what we like to do is to make sure that drugs are in somebody's house so that if they're needed, they can be used without people having to chase off to find the chemist. Planning medication schedules is really important because we have drugs that work differently. Morphine type drugs mainly come in 2 forms. One, the short acting, so that you can be confident that if anything crops up you can deal with it, but also the longer acting preparations that will give you 24-hour pain coverage. We have to have a good relationship with the patients. As a clinician, we need to work closely together because it's so important that people tell us what they're feeling so we can adjust the doses appropriately. What we know with drugs like morphine is that actually you just need to take as much as you need to deal with the pain. If pain gets less, then you can reduce the dosage. If pain gets more intense, then you increase the dosage. Addiction to the strong painkillers, especially morphine type drugs, is really not something that you should be concerned about because we are using the drugs in a very controlled way in the right dose to deal with specific symptoms. One myth that is quite commonly held to be true is that high doses of morphine when used to treat pain can shorten life. Actually, that isn't true. We know that if we use the right doses of the drug in the right way for the right length of time, it doesn't shorten life and it actually enhances life and may actually help life be longer because people are in a better position to eat and drink and they still feel that they've got a reason to live.